For over 20 years, Medical Home Plus has been serving families of children with disabilities throughout the Commonwealth of Virginia, regardless of the child's medical diagnosis or their family's ability to pay for our services. In fact, MHP never charges families for the services we provide, which means that we will never turn a family away. Having been born with a case of cerebral palsy from the waist down, my mother was told that I would never be able to walk. However, thanks to my mother's unwavering love and support and the work of some amazing pediatric orthopedic surgeons who performed over 5 experimental surgeries on my legs and hips over the course of my childhood, today I am able to walk freely without any braces or support. Because of my experiences growing up as a child with a disability, I understand the isolation and the hardships felt by both children with special needs and their families. And it is for this reason that I initially joined the board of directors for MHP 3 years ago. Today, I'm the vice president of the MHP board of directors and the chair of the organization's programs committee. As the chair of the programs committee, I actively work together with MHP, the board, and the staff to add a comprehensive transition planning program to the services we provide. After much hard work, we were able to announce the launch of our transition planning program last November at our 12th annual Uncorked Hope Gala event. This unique and impactful program is based on feedback that we've heard consistently from families we serve about the feelings they get as their children with disabilities approach the end of their public education journey. Families of children with disabilities describe the feeling of their children's support and accommodations coming to an end as falling off the edge of a cliff. So MHP knew we needed to do something to fill this gap because there truly were no resources for children or families in Virginia that successfully address these issues. Lack of transition planning has major negative consequences for a child with disabilities, their family, and our community. That is why MHP is working to positively combat the negative ripple effects and help people of all abilities experience and provide a meaningful impact in our community. Our transition planning focuses on 4 major areas which are customized to the individual child's strengths and interests. These areas are community participation, continuing education and training, independent living, and employment opportunities. Unfortunately, without effective transition planning, children with disabilities are statistically more likely to experience homelessness, incarceration, addiction, abuse, and complicated health comorbidities as adults. This is a really big problem that has long-lasting effects on our community, but we can help prevent all of these negative consequences and have long-lasting effects on our community through our transition planning services. But we can't do it alone, and we need your help. Since the launch of our transition services program, we have provided services to 42 children who would have otherwise potentially fallen through the cracks. And the needs and requests for our services continues to grow every day. Your donations and continued support are vital to ensure that we are able to keep up with the growing need for our services and to continue to provide the support to families with children with disabilities that they need. We want to take an opportunity to also thank the Truist Foundation and our board of directors for providing the initial seed money to launch these services, and we hope that you will join in our continued effort. At MHP, your child is our mission. Thank you for your continued support.